Morning, everybody. As usual, I'm 1 minute late. However, that's okay, right? So join me. I'll wait for you all to get in here. It is the end of Mental Health Month. Hey, Linda. Hey, Sarah. So the end of Mental Health Month. My hair's kind of goofy, isn't it? And so I thought we'd kind of do an update on how things are going around the country regarding mental health, because there's lots of stuff going on. So in preparation for that, or actually this, I spent, so for Memorial Day, I went down to Southwest Missouri, saw my children, my family, my grandchildren, etc. And when we got back yesterday, I added up, we'd been gone 28 hours. It felt like we'd been gone a week. And so that was probably a mental health break that we both needed. So yesterday I had brunch, I guess, breakfast with my son, and then we took a nice leisurely drive back through the back road highways of southern Missouri and the Ozarks, just to see all the beauty of spring in the Ozarks. If you haven't been here during the spring, or even in Missouri during the spring, it's wonderful. Hey, Eileen. Hi, Jen. So here's where we're at, and I'm going to go off to a different screen, so hopefully I don't disappear. Okay, so for the United States coronavirus update, so this is as of May 26th, 1,680,913 cases. So we went up 18,611 yesterday. We're at 98,913 deaths. We went up 693 yesterday. And interestingly, for the U.S. healthcare worker force, on April 17th, the CDC said we had about 9,300 infected health professionals. As of yesterday, we had 62,300 U.S. healthcare workers who've been positive for this virus. 291 have died, and that doesn't count the suicides. I think if you've been on social media, there was a report of a ER doctor from New York City that went back home to, I think, one of the Carolinas, and committed suicide over the death and destruction that she was seeing at work. So we're kind of in the middle. We were already having a mental health crisis, right? So if you think back, mental health has gotten some discussion going even before this COVID-19 thing. We really have to have honest conversations about how we're going to deal with mental health, because the crisis hotlines are blowing up. So, there's the suicide lines, the depression, mental health, reaching out for mental health stuff is going on as we continue to isolate. And of course, opening states and all that, we're starting to see an uptick. They're planning on an uptick again. So we might have flattened the curve and we may go down, but they're anticipating that this is going to ramp up, just like the SARS-CoV-1 of 2002, where we're going to have an elevation again, probably in the fall. So, and this is a different strain, so nobody knows quite what's going to happen. But the last time we had this SARS-CoV-1, that did uptick, and it actually was worse in the fall. So we may get a little bit of a break as we go into the summer, and we're getting there. It's starting to get warmer finally. But what's going on as far as mental health is that we're seeing an increase. We're seeing increases, and they're anticipating increases of people that are using substances, alcohol, whatever, to get through this while they're self-isolating. There's increased reports of domestic abuse, and there's increased reports of child molestations and all this kind of stuff. So not good. And we're social creatures. So if we're socially isolated, people look for things that may be not so good for their health in order to get through that. So anybody who, even before we've ever heard of COVID-19, worldwide, there was 264 million people struggling with depression. And I don't like that term. It's a label. Most mental health, a lot of mental health people do not like labeling or diagnosing people with depression. And I've told you that I always hesitated to put a diagnostic code of depression on patients because it can affect their ability to get life insurance in the future. It's considered a chronic illness. Even though when I was in medical school, it wasn't a chronic illness, it was kind of an acute illness that you could deal with over about a 3-month period. I mean, you had to have some therapy and cognitive behavioral therapy and a professional counselor to help you get through that. But it seems like most people think that it's something that you give a prescription for, and then you stay on it for life. So I read a report last week, or maybe earlier this week, where people that are on SSRIs like Prozac and Zoloft and Paxil. So Prozac came on the market in 1988. One of my nurse practitioner buddies from years ago thought that Prozac was life-saving for her, and she'd been on it for, back then, 15 years. So that was in 1993, I think she told me that. And they're finding that people that are on long-term SSRIs, like those that I mentioned, have a higher risk of dementia and Alzheimer's disease, which is, for my generation, we don't mind getting older. We just don't want to be demented, and we don't want to have Alzheimer's disease. So in the U.S., prior to COVID, there was 50 million adults that had experienced some form of mental illness in the past year. So there's 330 million American citizens, 50 million adults having some form of mental illness just in the past year. So with long periods of isolation, and you're not around your loved ones, loss of jobs and financial insecurity, daily stress, that's accelerating. Nobody knows the acceleration factor or the actual numbers because that's not really being looked at that much. But there are calls to mental health helplines that are surging. Okay, so see, there is a Qualtrics found that 52% of those now working remotely feel more anxious from working at home. So now we're going to flip over from depression to anxiety. And of course, you know, there are ways to interact through a screen or a phone or Zoom or FaceTime or Skype or however you're doing that as far as work. But you still don't have that social interaction per se, that face-to-face thing. So the short-term fixes can damage our mental and our physical health. So we're basically increasing our bad habits is what's being reported. Okay, so alcohol sales have jumped. So 75% increase in alcohol sales, 66% increase in wine sales, 42% increase in beer sales. Cannabis use was an all-time high in March. And of course, you know, you're dealing with a respiratory virus. So smoking, and if you're smoking cannabis, you're potentially taking a risk. It might increase the risk of the infection overall, including vaping. And of course, exercising has been going down. You know, I saw a video yesterday of people trying to do exercises at home, and all these things that happen to them where they potentially can get injured. It was kind of funny, but nevertheless, you know, chairs falling over, weights falling off on people, some of those resistance bands fleeing into their chest and their head and their face. And then, of course, the comfort foods we're eating more of. So the junk food, they list Oreos and Goldfish and Slim Jims. I don't know why they picked on those. There's plenty of junk foods that are around, but we already have an epidemic of childhood obesity. And so, you know, one of the things that you can do to keep your mind off of icky stuff is to learn how to cook or cook more. Some people don't like to do that. I happen to like doing that, but not everybody. That's not for everybody. So this is from, so let's look at this from an MRI perspective. So there's a PhD, Dr. Leanne Williams, Stanford, who has been looking at brain scans through MRI on what happens to the brain and blood flow during extreme negative stress. Okay, so stress by itself isn't bad. Just like when I talk about anger, anger is just anger. It's not bad or good. It's just there. Stress is the same way. If you live a stress-free life, you're probably not living your life, right? So what you want, some kinds of stress are positive. So if you've got a project that you're working on, and of course those have been kind of declined. And that, if you're achieving goals like that, you're actually building confidence in yourself. Okay, so, but for the most part, a lot of people get stuck. So they get stuck in a loop. And she's looked at several different things that she's seen, kind of like Dr. Amen. And if you haven't seen Dr. Daniel Amen, Amen, he's done a lot of brain scans over the last 25 years. He's got a TED Talk on TED Talk, or you can find it on YouTube. That's fascinating. It's so good. I showed it to my physiology class this semester, and they were kind of enraptured by listening to this guy talk about what your brain looks like on brain scans in different areas. So this not the physician, this PhD doctor lists 6 biotypes. Okay, and a brain circuit that most defines them, and some of the thoughts and emotions and behavior that is implicated in each one of those biotypes. Okay, the first 3 seem to be the most impacted during this current pandemic situation. And then she lists some stuff that you can do for tips on how to deal with those symptoms as they arise. So the first one she talks about is rumination. And anybody that, the definition of that word, most people have ruminated at one time or another. So it's a tendency to repeatedly worry and have negative thoughts from your inner voice. Okay, so if you have negative self-talk and you create actually more tension, and you can disrupt your social and workplace functions. Well, those are already disrupted. So if you're ruminating, you're disrupting them potentially even more. Okay, and that ruminating about things like that actually increases the activation of concerns about your health. Okay, those people are more likely to internalize health concerns and internalize them to their own experience and memory, which makes people feel more personally vulnerable and anxious. And of course, every headline, I get the Wall Street Journal every day. The main headline has to do with COVID-19. Okay, so what you want to do if you're a ruminative person, is to limit your exposure to the media and related information. Well, that's hard to do unless you just turn it off. Okay, so it's alarmist. Everything in the media right now is kind of alarming. And I've tried to be kind of unbiased, and pretty much I think I have done so when we're talking about the science about COVID-19, and somehow that's become sides and politicized. The hydroxychloroquine debate, all that other stuff that we've talked about over the last 3 or 4 weeks seems to have been politicized. So my friend Wynn Richards, in the middle of the night for some reason, went live and gave a really nice little talk about his personal experience with making choices. And I'm being tangential, so bear with my attention deficit disorder. But Wynn talked about personal choices that he made 4 years ago based on a health thing that happened to him. And if you watch this video, he's pretty open about it and what happened to him. But he made choices based on a financial, economic viewpoint. When in reality now, 4 years later, he kind of thinks, well, maybe I shouldn't have done that and done what my doctor said, even though that would have been economically disastrous for him. But it would have, he feels like he's no longer the same person. He's not at 100% like he was, which maybe nobody ever is after you have an injury or trauma or even get diagnosed with a chronic illness. But he kind of wishes he could go back and make a different decision because he thinks his health would have improved and he might be back closer to 100% even though he says, I probably would have lost my house and gone through bankruptcy. So he has a nice little he has some nice little commentary for in the middle of the night about the decisions that we're making from an economic viewpoint versus a humanitarian viewpoint. And we're kind of at a crossroads. The world is probably never going to be the same again. So we can look at it from one viewpoint or another. Ooh, we're not going to go back to where we were, which maybe wasn't such a great place. And that might be why, that maybe in other words, we got the time to actually not ruminate, I don't want to say that, but think about, okay, where were we and where do we want to go? So typically in history during a pandemic, people can really kind of think about their society and how they live their lives and go forward in maybe what's a better way to do that. So instead of ruminating about the negative, my point is, why don't we not necessarily ruminate, but think about what we're grateful for, what wasn't working, and how do we go forward with something that works better from the general standpoint of humanity and society, rather than worrying about the Dow Jones Industrial Average only. And I don't know how to open, because it seems like we're opening back up and things are getting potentially worse. The Lake of the Ozarks was very busy this weekend. I was down in that area, not at the lake, but I drove past it. And that, that video or those pictures of those people not social distancing kind of went viral on Twitter. And so Missouri made the national news kind of in a negative way. So we'll see how that pans out. The people that own that pool basically were screening people as they came in. If they had a temperature of 100.4 or higher, they weren't allowed in. And then they felt like this was an adult decision, and everybody that was there knew the risks. And you can't really enforce social distancing in a swimming pool, right? Okay, so now I'll get off my ADD train. We'll get back threat response. So we talked about rumination, now we're going to talk about threat response. So that's the default circuit in the brain, and it's a tendency to repeat it my allergies are kicking in. So threat response, negative circuits activated by threats that can be real or perceived in your environment. Okay, so we know some people that they won't go outside because, in their mind, there's big COVID-19 virus particles floating all through the air that they're going to breathe in if they go outside. That doesn't seem to be true. But if you consider that a threat response, real or perceived in your environment, then you become hyper attuned. You're totally attuned into those threats. Okay, so your body goes into alarm mode. And sometimes that's hard to switch off. And anybody that's gone through shakiness and being startled, they're automatic reactions. It's part of physiology. I teach it every semester. So if you heighten the reactivity of the brain's threat network, so anxiety, depression, post-traumatic stress disorder, you're kind of at risk of those all being exacerbated by any aspect of the COVID-19 that can trigger a past trauma memory. Okay, so in short, what you want to do is avoid the stimulus that activates those memories. So it could be media, it could be friends or family or neighbors who are having a panic attack or panic response to this, which then generates and triggers that threat response in you. And so one of the ways to combat that is to reach out to a mental health professional and they're all providing telemental health right now. I can name you I can think of people that are doing that. I can think of 4 off the top of my head. So that's possible. You can do that. You can find them on Facebook. You can find them all over the place. And they will do a telemental health consult with you. Okay. And so right now, licenses are crossing state lines, which they should have always crossed state lines. So you can reach out across state line and get telemental health or telemedicine. Okay. One of the things that I noticed this with my son yesterday, he had a conference call. I happened to be there, so I kind of overheard it with his superiors, I guess we'll say. And he works for a company that deals with disabled individuals and works with them at home. So there are issues that they went through about how to keep themselves safe, and they should be wearing masks. If they didn't wear masks, they were going to have a conversation, they said, about that. What was interesting is they spent about 40 minutes on the phone discussing their clients, and they never really, unless I missed it, they never really discussed how the people the people that were working for them, how they're doing mentally. They didn't ask them, are you having any trouble? It was just kind of like, do this, do that. This is what we got to do to protect ourselves. This is what we got to do to protect our clients, etc. But they never really did address the impact of this on the people working for them and the people that are dealing with these disabled adults from a healthcare perspective. So there are companies that are doing daily workplace debriefings to discuss the impact of the situation, but that can actually promote anxiety rather than help. So these people, they might be having debriefings, but maybe they're not coming from a viewpoint of helping settle concerns and anxieties and depressions in the people that actually work for them. Okay. Next one is emotional numbness, or anhedonia. And this is the brain's positive affect, or the reward circuit. Okay, so people that are having trouble in this area really they have trouble taking pleasure in activities that bring joy and purpose. So that's kind of one of the things that we talk about in medical school and residency about depression or adjustment disorder, which should technically be short-lived. Like I said, nobody should be on fluoxetine and all that stuff for years and years and years. I think that's rewiring people's brains, so it's kind of maybe not healing you. Okay, so people that are having trouble in this area feel like they're going through the motion, and they're not really experiencing any joy about what they're doing. And so large bodies of research from infancy, humans need social interaction, multiple sources of human feedback for brain development. And remember, your brain hasn't developed until you're about 25. Okay. And so you need that feedback from different sources to get a sense of positivity in your mind. And so anhedonia can involve a vicious cycle where the reward network is underactive, and you may retreat from interaction, not feel interested in usual activities or motivated to do them, pursue them, or anything. And right now the sources of stimulation are limited because people that are experiencing anhedonia kind of self-isolate anyway. And right now we're being forced to be physically isolated. Okay, so we're actually reinforcing anhedonia with shelter in place, right? So unless you have a large family living at home, so it's two of us here, so we're kind of the only interaction that we have for the most part. And I did, like I said, I saw my children on Monday and Tuesday, and we probably didn't socially isolate I don't think we had more than 10. But we kind of got real close to the fine line of not socially isolating. Okay. And then, you can reach out, but if you're going through a screen or a phone, you're not really getting that interaction that can avoid or get you out of the anhedonic cycle. Okay. So we pick up clues from looking in people's eyes, human feedback, touch, smell, body gestures, facial expressions, and all that. You can get the facial expressions, I guess, over a Zoom meeting, sort of, but it's still not quite the same. Okay, so right now, anybody that has a tendency to withdraw or feel no joy from what they're doing, that's all being exacerbated. And this is a risk factor for suicide, because anhedonia is already one of the biggest contributors to suicide risk. Okay, so they're anticipating that just normally healthy people are going to have periods of anhedonia as a result of physical isolation and limited channels of communication. Okay, so what you kind of have to figure out how to stroke your dopamine in a positive way. So if that's a smell, or if that's gardening, or if that's listening to music, images, drawing, painting, kind of things that kind of make you feel or allow you to feel joy is kind of what you kind of have to focus on. You can't do that on the media. I mean, it's all alarmist and horrifying, and who wants to listen to all that day in and day out for hours and hours and hours a day? So reducing your anxiety, dopamine is an anti-anxiolytic. Sorry, it's not anti. That sounds bad. It's an anxiolytic. So dopamine is the basis of addiction. So that's why they're worried about addiction. One of the addiction and people that that have just reached out to bad habits to stroke their dopamine. So one of the CEOs I read about was saying, well, what are we going to do if everybody comes back to work and we got a bunch of non-functional addicts that we're trying to, and of course addiction, that's a little bit over the top. I think not everybody that uses substances is addicted. But that was his thinking, was, well, what if they all come back and they've been sitting around for 2 or 3 months just drinking or whatever bad habit they're doing? Maybe they're not going to be functional in the workplace. Okay, next one is anxious avoidance. Okay, this is involving the brain's salient circuit. So you can have sources of anxiety that in turn have a physical expression, such as tightness in the gut, sweaty palms, palpitations, can further trigger a person to avoid situations that trigger that. And of course, we're right in the middle of a situation or a pandemic. So how do you remove yourself? Well, once again, you got to think of something else to do except listening to news reports or the fights over hydrochloroquine versus remdesivir versus social isolation versus opening the economy, et cetera, et cetera. So one of the ways people kind of do that is to avoid phone calls with people and kind of rely on texting. And I remember the first phone I got that had texts or texting capability was the Motorola Razr 1 phone. And when I bought that phone, the guy was telling me, oh, you'll be able to text. Isn't that great? And I go, that's the stupidest thing I ever heard. I'd never used that. Well, now that's not true. Most people would prefer to text back and forth than actually talk on the phone. So there's a little bit of a tendency to avoid vocal relationship, I guess. And if you're busy, I get it. A lot of times I'm busy and clients text me all the time. I hear from, I've heard from 3 this morning already. Okay, next one is inattention. So this is the brain's attention circuit. Okay, so you can't concentrate, you can't focus. Unless you're me and you have attention deficit disorder, I can focus on anything and bombs could be going off and I wouldn't even notice. But you can get worn out. So if you are forcing yourself to concentrate on a task, that's actually can be physically tiring. So even basic functions at home and work can be difficult to complete because you have inattention. You just want to shut down. Okay, and so this happens a lot. And I've watched actually a couple. I've watched this happen on Zoom meetings, and our little. I'm on Zoom. When I was teaching, I could see it. If they would turn their video on, most of these students would keep their video and audio off. So it's kind of like I was talking to myself, which is kind of what I'm doing right now. But you could see the ones that had the video on, you could see their inattention. And of course, maybe that's because I'm a boring teacher, but I don't think so. But you can see, I can see it in the classroom. I'll be talking and either sleeping or somebody's, fooling around on their phone or their eyes are wandering off and all that. So inattention it's really hard to focus and get concentrated on what you need to do. So this is a page from how to deal with ADD. And I'm the first to admit that I don't do this and I should. The common sense tip for this is to break your tasks so that you can into one step at a time and make a list. I know plenty of people make lists that don't have ADD, and every ADD person I know should make a list, because by the end of the day, you pretty much get them done. I don't know how many times I've had something on my mind and I think, okay, well, I need to get this done by the end of the day, and something else happens. It shifts my focus. I start focusing on that, and then I forget what I was going to do. And it might take me 2 or 3 days to get something that I think needs to be done in one day. It might take me 3 days to get it done. So make a list. Next one, cognitive fog. So this is control of your thoughts. So you may feel foggy rather than sharp. Okay, so difficulty making executive decisions because you cannot inhibit unwanted thoughts and reactions. So planning ahead can be difficult. Once again, a list, right? So we have all these unexpected changes in plans, changes in the work, changes in the family structure. Planning, adapting to change becomes more difficult. I'm kind of used to that. That doesn't really bother me because I was an obstetrician, and I like to always tell people I've been interrupted doing every human activity you can think of to run to labor and delivery because a baby's coming. So that shift of focus for a person like me is okay, but for other people, they don't like that. They want plans. I can think of a very close friend of mine that needs a plan. And I probably drive her nuts because I don't make plans. They always change. It always changes, and that's from 30 years of doing obstetrics. That's just the way it does, or the way it's been for me. Okay, so a common sense context. So with the rapid changes we're experiencing, our brains are also going through learning that has to be rapid and it has to be plastic. So it's changing, and that's that fighting about, you talk, when I give these talks about, well, this guy said this and this woman said that, and they're diametrically opposed, and I'm trying to show you where they're coming from, and maybe there's a little bit of truth on each side, and maybe a lot of untruth on each side. But basically, we're kind of going through a marathon of the brain, right? So we're trying to be flexible to the maximum, and not everybody can do that. So our brain just gets tired and you get fogged out, okay? So it'd be like if you were tired from minimal exercise to running the Boston Marathon. I mean, how far would you get? Not very far. So you need to rest. And that was the subject of 3 weeks ago. Sleep is number one. Your brain needs to rest, so does your body. Okay, so what else can you do? Okay, so what you've kind of got to think about is, what can you do if you're in some of those if your brain works that way. So hopefully I'm giving you 6. So hopefully one of them fits you, or you might be fine and everything's great. That's okay. But give yourself permission, if you're in the middle of one of those 6 types of brain thinking or functions, give yourself a break. This is a time period, at least for my generation, we've never dealt with. I mean, the closest I can think of is 9/11, and that lasted about 3 months. I mean, the country was very different for about 3 months, and then we got back to normal. I don't think we're going to get back to normal after this one. So what you ought to do is set a news and social media cutoff time, okay? So being informed can give you a sense of control, right? But you have to set limits. It's what we teach our children. I was just talking about one of my high school teachers yesterday. His favorite thing to say is, you people need to have self-control. Well, that's a maturity thing. He said that, I don't know how many hundreds of times he would say that in the classroom. Self-control. You got to have self-control. Okay, the other one is from breathing. This is from meditative stuff. So focus on your breath. Very simple. If you feel like you're not in control, then focus on your breath. Just breathe, feel it, meditate, whatever you want to call that. Most of those exercises, if you will, have to do with focusing on in and out breathing. Okay. The third one I'm seeing is, you're supposed to wash your hands for 20 seconds, which I guess is singing through Happy Birthday or doing the ABCs The other option is to think about stuff that you're grateful for. You can think of 2 or 3 things while you're washing your hands that are okay, instead of focusing on negative, nasty stuff, right? Okay. When you feel overwhelmed, again, go back to your breathing. Just ground yourself. I'm sitting in a chair. The wall is pale yellow. The light is on. Instead of reaching for a phone or going online or whatever, just pay attention to what's around you. It's pretty simple. Okay. If you're judging yourself, that's normal. What you're feeling is normal. Well, it's not normal to judge yourself, sort of, but don't judge yourself in a negative way for experiences and emotions and responses that you're feeling. Feelings aren't bad, they just are, right? Okay, so there's nothing wrong with you if you react to something strongly, but go back and focus on something that is not creating anxiety for you. Okay, and then again, make a list. If you got a whole bunch of stuff to do at work, and you've got kids around. I mean, parenting is a 24-hour-a-day job, right? And so there's a lot of people that are trying to work and teach and do childcare and all that. That's something that you're not used to. So make a list, get it done. You'll feel a sense of accomplishment. Trust me, every time I make a list, I get through it, I feel like, oh, I did a good job. When I don't make a list, which is most of the time, that's when it takes me 3 days to get something done, right? So that's my thoughts for today. Mental health, we're right at the end of Mental Health Awareness Month. And I think that I've talked about this a little bit, things that about COVID-19 other than death. Well, this is one of them. The other thing is there's a bunch of Ivy League schools that they've got free online courses. So that'll focus your mind on something else. State Fair Community College, where I'm on the faculty, has 10 courses that are business related that you can take for free. Very simple. Just go to State Fair Community College, based in Sedalia, Missouri. Just take a course. I mean, there's business stuff, there's social media stuff, there's how to do finance, kind of business finance stuff. And then the other one is the great courses. They got a pretty good deal going on. You get a month free of the great courses. And they basically have thousands and thousands of video courses where they've gone around to universities and good teachers. They haven't shown up in my classroom yet, so I'm kind of irritated. But they will do a video course on pretty much any topic you want to learn about. I mean, I'm talking about, like how to throw fastball to Aristotle, Plato, philosophy, science, chemistry, medicine, ancient Greek mythology, you name it. Great Courses has a video course. They give you a month free right now. I'm not an affiliate for Great Courses, so I'm not trying to promote them over something else. But right now it's $10 a month once you're through your first month, $10 a month or $30 every 90 days is how they bill you. And you can basically take a class in anything that if you went to that university, you have to pay the tuition to get this course. So that's a good one to do, I think. So just take a course, learn something new. You got the time, right? Okay, I'll talk to you Friday, and hopefully I'll come up with a different topic than something COVID related, so we can get off topic of that after I told you quit listening to media, although I'm not a media person. So I will see you all on Friday at 9:30, and we'll keep doing this, okay? Talk to you later. Have a good day. Bye.